I was born in Tanzania, East Africa. And my parents, because they were educators, they tried to give us the best education they could possibly. And although they were educators, they didn't have a whole lot of money. The income was very, very low. But they tried their best, made sure we go through the best schools we can. My mother had a scholarship to go to Canada for leadership training, and from there she looked into schools here in the United States, and women at the time and before that time were not allowed to really go to school or excel in anything, so she made sure that I would at least have that opportunity. And she spent all our retirement money to bring me here in the United States. And I went to a school called Cheney State, which had given me a tuition scholarship, but I didn't have room and board. I then ended up working 3 jobs while there to pay for my board, and then transferred to St. Joseph's University, where I completed my studies. But finally, Penn State said, we're going to take you and we'll help you get your green card, and you're going to come and go to school here. So I ended up going to Penn State, Hershey Medical Center, where the experience was tremendous. I was the only black student in my class, and I knew I had to excel. My mother quite a few times would write and tell me how I spent everything she ever owned, and that I must be careful and make sure I succeed in life. It was a lot of pressure. My intent was to either be a teacher or to be a doctor. I had seen quite a few sick people in Tanzania dying because of lack of basic care. I was young at the time. My brother had asthma and almost died, and it was the physicians were actually ignoring him. It was the aggressiveness of my mother that saved my brother. So I always wanted to become a physician. In 1988, I had completed all my requirements for medical school, and I had 3 months to spare. So my advisor and I talked about going back. I had this intense desire to go back and give back, or also look at what the hospital facilities were and what I could do to help. And I went to a hospital called Bugando in Tanzania. And while I was there, I was appalled at the situation. There were no bed sheets. The syringes were re-sterilized so many times. The gloves were dry and brittle and broke. The patients had no medications. If you got admitted, you had to call your family member. There were no phones. You had to actually send somebody to your family members to go to a pharmacy and buy you the medications you needed. It was then that I thought, well, perhaps I could impact a little bit. I had gone with a few drugs, and it was very fulfilling to see that I could give a patient a 10-day course of treatment and they would get better. Patients who didn't have any clothing, and I had taken boxes and boxes of clothes, and just the smile on these people's faces to pick a sweater or a dress was so gratifying. I also had taken instruments for the hospital itself, and the fact that I knew the surgeons were using those instruments to save a life or to change a life was very gratifying. And so when I came back and elaborated on my experience, that's when the idea of maybe getting a group together was formed.